Imagine battling addiction or mental health challenges, feeling overwhelmed, lost, and ready for help. Now imagine having nowhere to turn because you can't get to a clinic, you don't have reliable transportation, or you simply don't have the resources. Welcome to Celebrate Michigan, the show produced on the campus of Madonna University. I'm Chris Benson. Today we are talking with Jordana Latozas and Ian Wolf from the Recovery Mobile Clinic. The Recovery Mobile Clinic is all about meeting people where they are, literally. As a nonprofit on wheels, they bring addiction treatment and essential health care directly to communities across southeastern Michigan. I'm so glad you could be here with us today. Welcome to the show.
Thank you for having me. We're honored to be able to be here.
Excellent.
Happy to be here.
All right, Jordana, you are the originator of this organization.
Yes.
So why? What led to you saying, I've got to get started and I've got to do this work?
You know, there's never a real direct path in nursing and healthcare. There's always kind of a way to be flexible. And in my career path, I started as someone who's just interested in addiction. I will openly say I come from a family who struggles with alcoholism. And as a nurse practitioner, my very first job was in interventional pain management, which in 2010, not to date myself or anything, but was a very different world where we were being told that, opiates weren't addictive. Mm-hmm. We now know that's incorrect. Right. And then through the trajectory of my career, I ended up in a primary care office doing Suboxone therapy for individuals who are struggling with opiate and alcohol addiction. And what I learned in that area is that there's a lot of socioeconomic factors that come into play, not just the mental health and the addiction and the primary care physical side of it. If a patient couldn't get to the office, they could overdose or relapse or, God forbid, die from an overdose. And that did happen. And as a nurse practitioner who lost more than one is too many, right? Lost too many patients. I became frustrated that I needed to do more. And my husband sells RVs for a living, and he jokingly said at the kitchen table one day that I should put it in an RV and drive it around. And that's exactly what I did. That was in February of 2020, so right before the COVID pandemic, which actually worked out for us because there is a very heavy stigma around addiction, and there's a fear around a mobile addiction clinic coming into your area. Kind of the idea that I'd be like the Pied Piper and bring the problems with me. When COVID happened, we started doing COVID tests to get people housing. They needed, remember, you had to have a COVID test to get into the shelter, you had to have a COVID test to get into the nursing home or whatever it was. So we started doing COVID testing, and what that did was met the immediate needs of the community, taught them that we weren't the Pied Piper, we weren't the problem, we were a solution to an immediate need, and then we've been able to grow pretty exponentially fast since then. We now are running 5 RV units, 4 SUVs. We run anywhere between 5 and 7 clinics every single day, and we have a staff of 8 nurse practitioners.
Oh, and I saw you gesture to Ian there.
Yeah,
so,
yeah.
Ian.
And I'll add on that we also have a number of support staff ranging from phlebotomists to registered nurses, EMTs, firefighters as well. So we have an army of people that is definitely definitely helping us out to kind of achieve the goals of helping people out and being a resource for addiction and recovery. And so, I came into this organization about a year ago. Actually, it was my wife that applied for the job, and Jordana actually called me within hours and said, kind of explain what the organization does. And our goal is to be a resource for those that are in need. And it's not just people that are in drug or alcohol treatment centers. It is, we go to communities, we go to homeless shelters. Basically anyone who is in need of services can come and see us, whether it be urgent care services, whether it be case management services. We have the ability to do pretty much anything that urgent care or primary care doctor's office can do, but we do it on wheels.
Wow. I'm just struck by something that you both said, which is that it wasn't your plan, right? Like you went in with a different plan. Your wife applied for the job, and you were like just doing your work as a nurse practitioner, and then the frustration and everything. So it sounds like, again, this wasn't a straight line for you.
Absolutely right.
Like, you're like, yes, that's true. Talk about that a little more.
Well, that's kind of the beautiful thing about nursing, right? It's probably one of the most flexible careers possible. And nursing, the way it's structured, it really allows us to recognize a need and fill it. And so that's what I love about nursing. And the Recovery Mobile Clinic being the mobile model that it is, and mobile models being so new, it really allows for a little bit of creativity and a little bit of ingenuity. There's a lot of situations that you have to just work with what you got and kind of do the best thing for the patient in that time. And that's what's really kind of nice about the Recovery Mobile Clinic. It allows us to really see where the holes are, expand services, and then meet the needs of the community where they're at. So I mentioned that COVID-19 was a big propellant at the very beginning. Obviously, that's not so much of an issue now. Now it's more of the primary care and psychiatric services, but we've actually expanded into wound care. We've expanded into other aspects, again, based on the needs of the clients that we're running into. So it's a really neat way for creative individuals like Ian and myself to do the work that's so important in the community, but still be able to be flexible and see the growth in not only the nursing profession, but in the mobile model as a whole.
Well, and the fact that you thought like you'll start with one because of something our spouse says, it's amazing what kind of trouble that can get us into. But you'll start with one, and you have a whole fleet now. So then obviously the need is great.
Yes.
Talk about the need in the community.
Unfortunately, there is a huge need for addiction services, primary care gap services, and psychiatric services. There's a myriad of reasons of why that is. There's not enough providers, there's not enough locations, transportation in this area is not consistent for a lot of individuals. So we actually utilize a telemedicine model in some like more rural areas even. But because we are still seeing the expansion of addiction problems, it's not going away, it's actually increasing, that we have to get kind of the services out into the community. And what we're really aiming at is the people that are kind of falling through the cracks. They've been burned by the traditional healthcare system, especially during the opiate crisis. They've been turned away, they've been kind of pushed into a corner. They don't really have trust in healthcare providers. So we have to, a big part of our mission is increasing that trust level.
Well, unfortunately, we have to take a quick break. We'll be right back to talk more about Recovery Mobile Clinic. Stay tuned.
Here comes the Heffley family.
Whether it's a short trip or a long haul,
estimated time 47 hours.
they will beg,
You're hungry? I'm happy to provide.
they will plead.
Deep fried butter on a stick.
But whatever you do, don't wimp out.
Now you're talking?
Make them buckle up.
He can't hurt.
Remember, safety first. Cheese curls second.
Are you orange?
So we were walking to school. I started thinking about lunch. Mom packed me turkey and cheese.
She's
I really want
smart.
cheese pizza.
Sometimes her mind wanders.
We should have a sleepover.
I remember saying, Laura?
I think I heard Mom say something.
The sign says don't walk.
Sometimes it's so overwhelming.
I really hope she doesn't
I
have
really
another
hope I
bad
don't
day
have another bad day at
today.
school today.
When you can see learning and attention issues from their side, you can be on their side. Go to understood.org, a free online resource with support and tools to help your child thrive.
Mom, can I have $1? Yeah, it's right. I think my purse is upstairs on the bed. It's not here. Check the dining room. No. What about your sister's room? It's not there either. The upstairs closet? The downstairs closet?
There are no more closets.
Moms everywhere are finding ways to keep kids active and healthy. Get ideas, get involved, get going at letsmove.gov.
Sure, I look cute now, but when my owner lost his job, it was rough.
I was living on the street, and one night, me and this Cocker Spaniel got into it so bad, I wound up looking like an ice cream cone. I cried a little bit, but thankfully I got rescued, so I'm running, I'm jumping, all back to my old self. And I'm ready to give unconditional love, even if you put a lampshade on my head.
Back to Celebrate Michigan. I'm Chris Benson, and today we're talking with Jordana Latozas and Ian Wolf about the Recovery Mobile Clinic. So I know your organization is a nonprofit.
Yes.
What does that mean for the clients? What does that mean for you? Just explain that a little bit. People don't always understand what that means.
Sure. As a nonprofit organization, we will never send bills to clients. So we choose to offer free services to individuals who do not have health insurance. Now, we do bill insurance. That's how we're funded, mostly through Medicaid, but commercial insurances as well. The big nonprofit side of our organization is what we call the Patient Recovery Fund. So if you were to come to our golf outing, or if you were to send a check-in for, let's just say, $100. That money sits in our Patient Recovery Fund and waits for a patient that comes in that doesn't have health insurance. And then what we try to do is get them set up so that they can succeed. Our case managers jump in, try to get them on Medicaid, try to set them up with different payment models. After about 4 or 6 months, if we weren't able to get that patient on Medicaid or weren't able to get that visit covered, then your $100 goes directly to pay for that patient visit. So in that way, when you make donations to the Recovery Mobile Clinic, everything goes directly to patient care. So that's where that nonprofit comes in. But you know, it's nice to have those donations available because again, we will never turn patients away for having an inability to pay. So we treat and see patients no matter what their circumstances are. And sometimes patients don't even have an identification, right? Sometimes if they've just been released from the Michigan Department of Corrections system,
Yes.
or they're homeless and things have just gotten stolen, or whatever the situation may be. So again, we will never limit an access to care based on resources.
Really meeting them where they are.
Correct.
Absolutely.
What a wonderful mission of the organization. Well, I know we're going to show a couple pictures so our audience can kind of see what that work looks like. You know, we're thinking about it, but as we show the pictures, I wonder if you would talk about what we're going to be looking at here. Oh, there it is.
There is one of our units that's actually, we call her the OG. She's the first one. So she's actually our largest one that's on the road right now. So she is actually 30 feet, and that is down at Belle Isle after the Celebrate Recovery wellness event that's all about raising awareness and ending the stigma. That's also in RV1. That was actually one of our medical student volunteers. So he worked with us for a couple summers. So we like to take students out, nursing students, nurse practitioner students, medical students, social work students. I've had criminal justice students out. Anybody to kind of get the experience of working with this population and really getting the idea of ending the stigma against substance abuse and mental health.
I would never know that's mobile either. It's very roomy in there.
Yes.
You know?
Again, that's me out in front of, that's still one. She was my favorite one for many years.
She's a lot of fun to drive.
Yes,
I'll bet.
actually.
I'll bet. My gosh, that's a wonderful visual just to give us an idea of this work that you're doing. As you think about this work, I'm sure there's many, many people you've interacted with, and there may be a story that sticks with you, that inspires you, or reminds you on those tough days, like, okay, here's why I do this work. Any stories you'd like to share with us?
Actually, I have there's one patient that I saw a while back. I've been working with the gentleman for about a year now. It was his first time in treatment for a substance use disorder. He came in very anxious, very depressed. We started talking. He was very distrustful of me initially. But I sat down and we had probably a good 20, 30-minute conversation, just not talking about medicine, not talking about substances, just talking about life. And one of the things that we at the Recovery Mobile Clinic try to do is we try not to just do the medicine. We try to meet people at eye level, have conversations, ask them about their day, things that they may not have been asked before. And by the end of the visit I had with that patient, He was willing to start some psychiatric medications. He was willing to trust me. He even stood up, hugged me, and was crying into my shoulder, saying thank you. A year later, he is now one of the managers of a recovery house. He has outside work. He has a car. He still comes in every week to see me and hug me.
Wow.
And it's such a rewarding feeling as a provider. He's told me multiple times, "You've saved my life." And to which I say, I was just a resource. I was just someone who's willing to sit down and listen to you. You did all the work. I just kind of gave you a push in the right direction, planted seeds. And that's really what we try to do for people. If we can't necessarily help them that day, we plant seeds. And, not every patient is going to come to us open to recovery. But there's going to be that day when they're sick and tired of being sick and tired, and they know that they can come to us. They know that they can trust us. They know that they're in a safe place with someone who cares about them. And that's one of the most beautiful things about my job, and one of the things that I look forward to driving into work every day. Who am I going to meet? Who am I going to talk to? I have this belief that every person who's suffering from a substance use disorder is one choice, one decision, one interaction, one positive event away from long-term sobriety. And I want to be there. I want to listen to them. I want to be open. And I want to help them be the best version of themselves that they can be.
Wow. Well, and from what you said earlier, I mean, all of us are touched by addiction, and there's so many different kinds. I would guess that the statistics would say that everyone watching, every one of us knows someone or has someone close to us within our circle who's affected by this. And so that message is so compelling. Thank you so much.
No problem.
My gosh, we have to take another break. It comes too fast, but we'll be right back and we'll talk more with our new friends about the Recovery Mobile Clinic. Stay tuned to learn more.
I want to see the world.
When you pick up a book,
I used to read every night to all the younger kids.
And let your imagination break free, you won't believe how much fun it can be.
Let down your
Experience a world of adventure, excitement, and endless possibilities. Get tangled up in a good book. Explore new worlds. Read. Visit read.gov today.
There's a lot of fear in coming back to school. I'm a 40-year-old man that walked in there to get his high school diploma. It was very hard for me, but one of the teachers was Miss Araceli. She gave me direction. Every single time I had a question, she'll put down whatever she's doing and she'll sit there with you until you get it. 50% of getting your high school diploma is walking through those doors. The other 50% is doing the work.
Find free adult education classes near you at finishyourdiploma.org.
So, are you going out tonight? I can't. My parents say I have to be home right after work. That's so gay.
Totally gay.
Ugh, that is so Emma and Julia.
Why are you saying that's so Emma and Julia?
Well, you know when something is dumb or stupid, you say that's so Emma and Julia.
Who says that?
Everyone.
Imagine if who you are were used as an insult. When you say that's so gay, do you realize what you say? Knock it off.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
Welcome back to Celebrate Michigan. I'm Chris Benson, and today we're talking with Jordana, Latozas, and Ian Wolf about the Recovery Mobile Clinic, which is all over southeastern Michigan. And I understand Wixom, you're in Wixom now, but you're going to be doing something more than just Wixom. Tell me a little bit about that.
Absolutely. So currently our main office is out of Wixom, but we recently have are going to expand out into the Macomb area as well. We currently have sites out in the Macomb area, but we're actually opening up a physical office there with hopes of expanding up into the Thumb, trying to increase our coverage and our impact on the communities throughout that area as well.
Awesome, awesome. So anyone who's watching this show, and it goes throughout, parts of Michigan, and they're thinking, I want to help or I want to get involved, how can people out there plug in to this organization?
Absolutely. If you're a student, we love to kind of get you out onto one of the units and give you a really cool clinical experience, kind of what I talked about before. We are on social media, Facebook, TikTok, Instagram, so if you could even follow us, like and share, that really helps, because what we're trying to do again is increase that mission and end the stigma. We do take donations, like I mentioned, and that can be done on Venmo as well as on our website, therecoverymobileclinic.com. But we also have Amazon shop. We take donations for water, candy, socks, toothbrushes, soap, anything that you would think from a hygiene basis somebody would want, and then we disseminate those out to the clients that we see. So there's a lot of ways to get involved, and you can contact us on therecoverymobileclinic.com or email me as well, and we can let you know how you can kind of help the mission. But really the biggest way to help, doesn't cost any money and it doesn't take any time, is just tell your story. So many people struggle with substance use or know somebody who does, and we have a tendency to bury it and hide it. And what that does is create this stigma, this fear of accessing care because of the fear of the retaliation from the disease, which is actually greater than dying from the disease itself, which is very bizarre. So if we can start increasing our stories, increasing the willingness to talk about the struggles that all of us are having, then that will encourage somebody else to actually reach out and ask for help. And it doesn't cost anything and it doesn't take any time.
Unless we judge people or people get in that judging place, when you think of the addictions that people walking around, you may not notice, like social media addictions, caffeine addictions, addictions to just stress, or high pressure situations. It's again something that touches all of us. And when we have services like what you guys are providing in the community and what you're reaching out, that's very visible, but we're all struggling on some level with that. And so I just appreciate so much your message of, it really is a message of hope. And so as I ask this next question, I think about the work that you and your team, your army, as you said, do every day. What is your hope for the future of this? From one RV, what do you hope to see?
My big picture dream is to expand the mission of the mobile clinics and actually empower nurse practitioners like Ian to operate their own. So my big dream is to have one mobile clinic in all lower 48 states by the time I retire. That's my small goal. But really, I want to work myself out of a job. Right?
Absolutely.
If we can get an NP Army out there really taking on addiction and mental health to the point where we're not needed anymore, that's my dream.
Wow. And Ian, when you see your future, you came to this, you've only been there a year, you said.
That's right.
What do you hope for? What do you told such a compelling story before the break. What do you hope for?
On a day-to-day basis, I want to make one person's life more positive. I want to have that little bit of influence on a day-to-day basis, pushing somebody to be a better version of themselves. Long term, I'm not really sure yet, I'm still kind of coming into my own a little bit within the Recovery Mobile Clinic, but, I know for sure that I have a bright future with the organization. I have wonderful mentors like Jordana that, empower me to be better for myself, but also to be better for the patients that we serve. So where that ends up, I don't know, but it's great places.
And I love that you've shared, you know, you mentioned being a nurse, and when you say that, people who aren't in the nursing profession might just think hospital, bedside, but there's so many ways and there's so many different career paths.
Absolutely.
I mean, did you ever think you'd be doing this?
No, you know, nobody, 6 years ago, I wouldn't have thought that I would be doing this, right? Owning my own, you know, running a business on my own was terrifying. But I think what I've kind of learned through all of this is that I'm not alone, right? Nursing is a huge network of individuals that want to help. You know, we can build a fantastic team that works together for the same cause and the same mission. We have a fantastic network of community partners and agencies that we work with together, all angling to support the patient and help them transition through kind of a very complicated medical system. So for those nurses out there that are thinking about, you know, operating your own clinic one day, it is doable and it is rewarding and it is worth it, and your patients will thank you.
Well, I want to thank both of you for caring for everyone in our community, because if one person is hurting in our community, we're all hurting. And the fact that you dedicate each of your days to reaching people that really need it and just can't get what they need, I just want to thank you for that, because that's really important and very special, and I think it helps go a long way toward us caring about each other more in our wonderful state of Michigan.
Thank you so
Thank
much.
you both. It's been a pleasure to have you.
Thanks for having us.
Thanks. And thank you. That's all we have time for today, but I'm so grateful that our guest, Jordana Latozas, and I know I said that wrong, say it again. Latozas and Ian Wolf joined us. We want to thank you for watching and joining us at Celebrate Michigan, where we celebrate all the fantastic things happening in the Mitten State. We'll see you next time.